Preterm ovarian hyperstimulation. Definition: is very rare entity characterized by vulvar hypogastric and upper leg swelling, elevated serum estradiol and gonadotropin levels, and ovarian follicular cysts. 1 to 3. The main etiology is the immaturity of the gonadal axis and the lack of the negative feedback of the placental steroids.
So ovarian hyperstimulation syndrome is when the ovaries begin to, and it's really triggered by the HCG exposure. The HCG, which we use to trigger the final maturation, and if the patient is pregnant, HCG is produced by the pregnancy a few days or a week later. It affects the ovaries in such a way through generation of some vascular endothelial growth factors to start leaking fluid. And what happens, the ovaries become very large and they exude fluid into the peritoneal cavity, into the abdomen. What a woman feels is that she's very bloated, the ovaries are very large, there is fluid accumulation in the pelvis and the abdomen, sometimes even in the chest. That is painful, that is uncomfortable, or women usually complain of shortness of breath, epigastric pain in the stomach area, and it's all because of accumulation of large amount of fluid. The other dangerous thing about that's the discomfort, of course. The other thing is that there are fluid shifts. The patient actually may have a lot of fluid in her abdomen, but not enough in her vascular system. So there are women are at risk for blood clots and electrolyte imbalances. So it is a very serious situation. Women who are at most risk for this syndrome are women with PCOS condition, and particularly women with PCOS condition who are slender. It's an interesting inverse relationship that heavier PCOS women are at low risk. They are at some risk, but at low risk than the slender women with irregular menses and PCOS symptomatology. Younger women, of course, are at high risk for this syndrome because an older woman doesn't produce as many eggs or as high of an estrogen level, she would be at low risk for OHSS in that setting.
Pros and cons. The pros will have the resolve spontaneously without treatment and is an easy diagnosis. The cons: severe symptoms are fullness, bloating above the waist, shortness of breath, pleural effusion, urination significantly darker or has cysts, calf and chest pains, marked abdominal bloating or distension, and lower abdominal pain.
Women who use fertility medications, particularly those drugs that stimulate multiple follicles to develop, are at risk of a disorder called ovarian hyperstimulation syndrome, also known as OHSS. OHSS is the result of stimulation of the ovaries with medications. It doesn't happen in very many people, but it can occur in up to 5% of women to a significant degree. In a small portion of those women, hospitalization is required. The medications used for ovarian hyperstimulation cause the ovaries to become leaky. Sometimes fluid will exude from the ovarian tissue into the pelvic cavity, causing women to fill up with fluid in their abdomen. Sometimes that fluid can actually travel up to the spaces outside the lungs and cause difficulty with breathing. These are only, however, in the most severe cases. Ovarian hyperstimulation syndrome is often preventable. If a reproductive endocrinologist is monitoring the cycle very carefully, looking at blood estrogen levels and ultrasound examinations during the stimulation cycle, that doctor can often prevent OHSS from occurring. Some women are much more prone to OHSS than others. For example, young women Women with lots of follicles, for example, women with polycystic ovary syndrome, are the ones who are most susceptible to OHSS. Should OHSS occur, the treatment is usually just supportive care. In other words, the disorder always goes away by itself. However, the symptoms can be very difficult, and in most severe cases, it can be life-threatening. In severe cases, women might have to be hospitalized and receive intravenous fluids. In some cases, a needle is placed into the abdominal cavity and liters of fluid extracted. This can help the patient feel like she can breathe more easily and urinate more easily. Ovarian hyperstimulation syndrome occurs in many women. However, it is only severe in a small minority. A good reproductive endocrinologist who is board certified and trained in the management of fertility patients and ovarian hyperstimulation syndrome is required to avoid the complications of this disorder.
Application in medicine. A pathognomonic sign of POHS is swelling which develops around 37 plus or minus 3, and the syndrome is only infrequently diagnosed when the swelling is profound. The direct etiology factor here is not E2. POHS does not require therapy as long as there is no danger of cyst torsion. Issue in ECOR. It is classified by the severity of the symptoms, which include increased ovarian, multiple ovarian follicles, ovarian cysts, cysts, and generalized edema. 4 weeks after presentation, the estradiol level peaked at 700 pmol per liter and then declined, with estradiol and gonadotropin levels gradually returning to normal. 6 weeks after presentation, swelling had reduced considerably, with complete resolution by 14 weeks. Repeat ultrasonography revealed that the ovarian cyst had disappeared, and the infant remained well at follow-up 12 months after presentation.